A shift in perception. Do doctors still hold all the answers? There's a sentiment echoing among patients today, a feeling that doctors, once revered as infallible sources of medical wisdom, seem less sure, less knowledgeable. This sentiment is fueled by the vast amount of information available online, where patients can research symptoms and treatments on their own. The internet has become a double-edged sword, providing valuable information but also overwhelming patients with conflicting advice and unverified data. This has led to a more skeptical and questioning patient base, who often come to appointments armed with printouts and questions, challenging the traditional doctor-patient hierarchy. This isn't to say they aren't brilliant minds, rather it reflects a shift in the doctor-patient dynamic and the evolving landscape of healthcare itself. The relationship has become more collaborative, with patients taking an active role in their health decisions. This collaboration can lead to more personalized care, as doctors and patients work together to tailor treatments to individual needs. However, it also requires doctors to be more communicative and transparent, explaining complex medical concepts in layman's terms and addressing patients' concerns thoroughly. Gone are the days when doctors held court in their offices, armed with stethoscopes and little black books of remedies. The image of the all-knowing doctor has evolved, and so has the practice of medicine. Today, doctors are more likely to be seen as part of a multidisciplinary team, collaborating with specialists, nurses, and other healthcare professionals to provide comprehensive care. This team-based approach ensures that patients receive well-rounded treatment, but also means that no single doctor can be expected to know everything. Today's medical landscape is a whirlwind of advancements, with new research, technologies, and treatment options emerging at a dizzying pace. Innovations such as telemedicine, AI diagnostics, and personalized medicine are transforming how care is delivered. These advancements offer incredible potential for improving patient outcomes, but also require doctors to continuously update their knowledge and skills. The integration of technology in healthcare has made it possible to diagnose and treat conditions more accurately and efficiently, yet it also adds layers of complexity to the practice of medicine. This rapid evolution of medical knowledge, while exciting, can also feel overwhelming for both patients and physicians. Doctors must stay updated with the latest developments, which can be a daunting task, given the sheer volume of new information. Continuous education and professional development have become essential components of a doctor's career, requiring them to balance clinical duties with ongoing learning. For patients, the influx of new information can be confusing, making it difficult to discern credible sources from misinformation, further complicating their interactions with healthcare providers. Patients, bombarded with information from various sources, may perceive their doctor's reliance on technology, or their occasional need to consult resources as a lack of expertise. This perception can lead to a lack of trust and confidence in their healthcare providers. However, the reality is that modern medicine is a collaborative effort, often requiring input from various specialists and the use of advanced tools to ensure accurate diagnoses and effective treatments. Doctors' use of technology is not a sign of weakness, but a testament to the complexity and precision required in contemporary medical practice. However, this perception often misses the bigger picture: the reality that medicine today is more complex than ever before, demanding doctors to be not just knowledgeable, but adaptable, tech-savvy, and effective communicators. They must integrate new tools and information into their practice to provide the best possible care. The modern doctor is a lifelong learner, constantly evolving to meet the challenges of an ever-changing medical landscape. This adaptability is crucial for delivering high-quality care and ensuring that patients benefit from the latest advancements in medical science. The doctor of yesterday, the physician of today, a transformation in roles. The image of the old-time doctor, making house calls with a trusty black bag in tow, seems almost quaint in today's technologically driven world. These doctors were often the sole healthcare providers in their communities, offering a personal touch and a deep understanding of their patients' lives and histories. They knew their patients by name, understood their family dynamics, and were often seen as pillars of the community. Their practice was as much about building relationships as it was about treating ailments. The past saw doctors as solitary figures, their knowledge acquired through years of study and experience often passed down through generations. They were revered as wise and authoritative figures whose word was rarely questioned. Medical knowledge was a closely guarded secret, and the doctor's authority was seldom challenged. This era of medicine was characterized by a deep sense of trust and respect between doctor and patient, with the doctor often seen as a community leader. Fast forward to the present, and the role has undergone a dramatic transformation. The modern physician operates in a vastly different environment, one that is fast-paced and heavily reliant on technology. The advent of electronic health records, telemedicine, and advanced diagnostic tools has revolutionized the way doctors practice medicine. They now have access to a wealth of information at their fingertips, enabling them to make more informed decisions and provide better care. However, this also means that they must constantly adapt to new technologies and stay updated with the latest advancements. Doctors today operate within a complex network of specialists, labs, and cutting-edge technologies. They collaborate with a wide range of healthcare professionals, from nurses to surgeons to researchers, ensuring that patients receive comprehensive care. This multidisciplinary approach allows for more specialized and effective treatment plans, but it also requires doctors to be excellent team players and communicators. The modern healthcare system is a collaborative effort, with each professional bringing their expertise to the table to provide the best possible care for the patient. They're no longer just diagnosticians, but navigators, guiding patients through a maze of treatment options and medical advancements. This role requires them to stay updated with the latest medical research and technological innovations. They must be able to interpret complex data and translate it into actionable treatment plans for their patients. This involves not only understanding the science behind the treatments, but also considering the patient's unique circumstances, preferences, and values. The modern doctor must be both a scientist and a compassionate guide. This shift from a paternalistic model of care to a more collaborative one requires doctors to be adept communicators, explaining complex medical information in ways that patients can understand and make informed decisions about their health. The modern doctor must balance empathy with expertise, ensuring that patients feel heard and supported throughout their healthcare journey. This involves active listening, clear communication, and a genuine commitment to patient-centered care. By fostering a collaborative relationship, doctors can empower patients to take an active role in their health and well-being. Embracing technology, Google, databases, and the modern medical toolkit. The sight of a doctor typing symptoms into Google might seem jarring to some patients, leading them to question the expertise of their healthcare provider, fueling the perception that doctors are Googling their way through diagnoses. However, this is a misconception. In reality, doctors use search engines as a supplementary tool to cross-reference symptoms and ensure they consider all possibilities. The reality of modern medical practice is that technology has become an indispensable tool, enhancing the capabilities of healthcare professionals. It allows them to access a broader range of information and stay updated with the latest medical advancements. Doctors today have access to a wealth of information at their fingertips, enabling them to make more accurate and timely decisions. This access helps in diagnosing rare conditions, understanding complex cases, and providing evidence-based treatments. From online databases like UpToDate and PubMed to sophisticated imaging technologies and electronic health records, the resources are vast. These tools offer comprehensive data that can be critical in patient care, from initial diagnosis to ongoing treatment plans. These tools allow them to stay abreast of the latest research, access patient histories, and integrate new findings into their practice. This integration ensures that patients receive the most current and effective treatments available. They can even consult with specialists across the globe in real time, breaking down geographical barriers to expert advice. This global connectivity enhances collaborative care and ensures that patients benefit from a wide range of expertise. While the foundational knowledge gained in medical school remains crucial, continuous learning is essential in this ever-evolving field. Medical professionals must constantly update their skills and knowledge to keep pace with new discoveries and technologies. The sheer volume of medical information makes it impossible for any doctor to retain everything, necessitating the use of digital aids. These aids help doctors manage the vast amount of data and apply it effectively in clinical settings. Online resources and databases serve as extensions of their knowledge base, providing quick access to the latest medical information. This immediate access is crucial for making informed decisions, especially in emergency situations. This allows them to provide more informed and up-to-date care, ultimately improving patient outcomes and advancing the field of medicine. The integration of technology in healthcare not only enhances patient care, but also drives innovation and progress in medical science. The overburdened healthcare system, a doctor's daily juggling act. The pressures on doctors today extend far beyond keeping pace with medical advancements. They're also grappling with an increasingly overburdened healthcare system, characterized by long hours, administrative burdens, and a constant influx of patients. Doctors often face packed waiting rooms and are pressured to see more patients in less time, leaving them with limited time to delve into individual concerns and provide the personalized care they strive for. This can lead to rushed appointments, leaving patients feeling unheard or dismissed. Furthermore, the administrative demands placed on doctors, from insurance paperwork to electronic health record documentation, can be overwhelming, taking away valuable time that could be spent with patients. This administrative burden contributes to physician burnout, a growing concern within the medical profession. The rise of the informed patient, self-diagnosis, and its implications. In this age of instant information, patients are more proactive than ever before. With the internet at their fingertips, they can access a wealth of medical knowledge that was once only available to professionals. This shift has empowered patients to take charge of their health, making them more engaged and informed about their conditions. Armed with Dr. Google and a plethora of health websites, they often arrive at appointments with a self-diagnosis in hand, ready to discuss treatment options. This can lead to more productive conversations with their healthcare providers, as patients are better prepared to ask relevant questions and understand medical terminology. While this reflects a positive shift towards patient empowerment, it also presents challenges. Doctors may find it difficult to navigate the influx of information patients bring, some of which may be inaccurate or irrelevant. This can complicate the diagnostic process and strain the doctor-patient relationship. Information gleaned online can be inaccurate or misleading, leading to unnecessary anxiety and potentially harmful self-treatment. Patients may misinterpret symptoms or follow advice that is not tailored to their specific medical history, resulting in adverse outcomes. It's crucial for patients to remember that online information is no substitute for a doctor's expertise. Healthcare professionals have years of training and experience that enable them to interpret symptoms accurately and recommend appropriate treatments. Trusting their judgment is essential for effective healthcare. While research is valuable, it's essential to share your findings with your doctor, allowing them to provide accurate diagnoses and personalized treatment plans. Open communication ensures that patients receive the best possible care, combining their own research with the professional expertise of their healthcare providers. Bridging the gap: effective communication in the doctor's office. The key to bridging the perceived knowledge gap between doctors and patients lies in effective communication. This involves not just the exchange of information, but also the ability to understand and empathize with each other's perspectives. When doctors take the time to explain diagnoses and treatment plans clearly, patients are more likely to follow through with recommendations. Both parties have roles to play in ensuring a productive and informative doctor's visit. Patients should feel empowered to ask questions and seek clarification, while doctors should encourage this dialogue. A mutual understanding can significantly enhance the quality of care and patient satisfaction. Patients can start by being prepared, jotting down symptoms, listing medications, and preparing questions beforehand. This preparation helps ensure that all concerns are addressed during the visit, making the consultation more efficient and comprehensive. Additionally, bringing a list of current medications can help avoid potential drug interactions. Being open and honest about concerns, even those deemed embarrassing, allows the doctor to provide comprehensive care. It's important to remember that doctors are trained professionals who have likely encountered similar issues before. Full disclosure can lead to more accurate diagnoses and effective treatment plans. Doctors, on the other hand, can foster a more collaborative environment by explaining medical jargon in layman's terms. Using visual aids and analogies can make complex information more accessible. This approach not only educates patients but also empowers them to take an active role in their healthcare decisions. Actively listening to patient concerns is crucial. This means giving patients the time to express themselves without interruption and acknowledging their feelings. Taking notes during the conversation can also show that the doctor values the patient's input and is committed to addressing their issues. Acknowledging the emotional impact of illness is another important aspect. Empathy can help build a stronger doctor-patient relationship, making patients feel understood and supported. This emotional connection can be particularly beneficial in managing chronic conditions or navigating difficult diagnoses. Taking a few extra minutes to connect on a human level can go a long way in building trust and alleviating patient anxieties. Simple gestures like making eye contact, sharing a light moment, or offering a reassuring word, can make a significant difference in the patient's experience and overall satisfaction with their care. The doctor-patient partnership, a collaborative approach to healthcare. The evolving landscape of healthcare necessitates a shift from a paternalistic model, where doctors dictate treatment, to a collaborative partnership between doctors and patients. This change is driven by the recognition that patients are more informed and empowered than ever before, thanks to the vast amount of medical information available online. As a result, the traditional hierarchy in healthcare is being replaced by a more balanced relationship. In this partnership, doctors serve as medical guides, providing their expertise, explaining options, and working with patients to develop personalized care plans. This approach ensures that patients are not just passive recipients of care but active participants who have a say in their treatment. By involving patients in the decision-making process, doctors can tailor treatments to better suit individual needs and preferences, leading to more effective and satisfactory outcomes. Patients, in turn, become active participants in their health journey, informed decision-makers who understand their conditions and treatment choices. They are encouraged to ask questions, seek second opinions, and research their health issues. This active involvement helps patients feel more in control of their health and more confident in the care they receive. It also promotes a deeper understanding of their medical conditions, which can lead to better self-management and adherence to treatment plans. This collaborative approach fosters a sense of trust and mutual respect, leading to better communication, improved adherence to treatment plans, and ultimately, better health outcomes. When patients feel heard and valued, they are more likely to follow medical advice and stay engaged in their care. This partnership not only enhances the patient experience but also contributes to more efficient and effective healthcare delivery, benefiting both patients and healthcare providers. The evolving landscape of medical knowledge, the rapid pace of medical advancements, while a testament to human ingenuity, can feel overwhelming, especially as new technologies and treatments emerge almost daily. This constant influx of information requires doctors to stay updated with the latest research and clinical guidelines, leading some to question whether doctors can truly keep up. The sheer volume of new data can be daunting, and the pressure to remain current is immense. However, continuous education and collaboration among medical professionals help bridge this gap. The truth is, medicine has always been a dynamic field, evolving with each new discovery and innovation. Historical advancements such as the development of antibiotics and vaccines have revolutionized healthcare and set the stage for modern medicine. With new discoveries constantly reshaping our understanding of health and disease, breakthroughs in genetics, immunotherapy, and personalized medicine are just a few examples of how our knowledge base is expanding. The difference today is the speed at which this knowledge evolves. The digital age has accelerated the dissemination of information, making it easier for doctors to access the latest research and clinical practices. What was considered cutting edge a decade ago might be outdated today. This rapid obsolescence of medical knowledge necessitates a flexible and adaptive approach to healthcare. This constant evolution requires doctors to be lifelong learners, continually engaging in professional development and training. Medical conferences, online courses, and peer-reviewed journals are essential tools for staying informed, constantly updating their knowledge base and embracing new technologies. Virtual reality, artificial intelligence, and telemedicine are transforming how doctors diagnose and treat patients, making healthcare more efficient and accessible. This doesn't mean they're expected to know everything. Instead, it emphasizes the importance of collaboration and teamwork in modern medicine, where specialists and general practitioners work together to provide comprehensive care. Rather, it highlights the importance of their role as medical navigators, guiding patients through the complexities of the healthcare system. They help patients understand their conditions, treatment options, and the implications of new medical findings. Guiding patients through the complexities of the healthcare system and connecting them with the right specialists and resources. This ensures that patients receive the most appropriate and effective care tailored to their individual needs, and connecting them with the right specialists and resources. By leveraging their expertise and networks, doctors can provide holistic care that addresses both immediate and long-term health concerns. Conclusion: navigating the future of healthcare together. The perception that doctors are less knowledgeable today is a complex issue, rooted in the rapid evolution of medical knowledge, which has expanded exponentially over the past few decades. This growth has made it challenging for any single practitioner to stay abreast of every new development, leading to a reliance on specialized knowledge and collaborative efforts within the medical community. The pressures of a strained healthcare system, including increased patient loads, administrative burdens, and limited resources, further complicate the ability of doctors to provide the personalized care that patients expect. These systemic issues often result in burnout and stress among healthcare workers, impacting their performance and patient interactions. Additionally, the rise of the informed patient, empowered by access to vast amounts of medical information online, has transformed the traditional doctor-patient dynamic. Patients now come to consultations armed with their own research, which can both aid and complicate the diagnostic process. While challenges undoubtedly exist, the future of healthcare hinges on a collaborative approach, one where doctors and patients work together, leveraging technology, embracing open communication, and fostering mutual respect. Telemedicine, for instance, has the potential to bridge gaps in access to care, allowing for more flexible and timely consultations. By acknowledging the changing dynamics of the doctor-patient relationship and embracing a partnership model, we can create a more supportive and effective healthcare environment. This model encourages shared decision-making where both parties contribute their knowledge and perspectives to achieve the best outcomes. We can navigate the complexities of modern healthcare by integrating advanced technologies such as AI and machine learning to assist in diagnostics and treatment planning. These tools can enhance the capabilities of healthcare providers, ensuring more accurate and efficient care, and ensure that everyone has access to the best possible care. By fostering a culture of continuous learning and adaptation, we can meet the evolving needs of patients and maintain the trust and confidence that are essential to the doctor-patient relationship.